Welcome to Baylor Scott & White Health's Post-Doctoral Fellowship in Health Service Psychology. I'm Dr. Mary Catherine Clemens, current program director and former graduate of our APA accredited program, housed here in our nationally recognized healthcare system. We're excited that you're interested in learning more about our program and what we have to offer you in your career. We have 2 full-time positions with 3 possible tracks: our end-of-life care grief and bereavement track, our consultation liaison health psychology track, our integrated primary care psychology track. We hope that this video provides a glimpse into our fellowship here, what we have to offer you, and how we can help launch your career in health service psychology.
I was really looking for a fellowship that was going to offer health-related experiences outside of a traditional outpatient mental health setting, and so I really liked the balance of outpatient mental health work alongside the inpatient work.
And I think the coolest opportunity we get is also, we have access to primary care. We have access to all different types of psychologists, and there's a children's hospital, and so the opportunities are just vast.
Baylor Scott & White Health is a level 1 trauma center with 650 beds, serving a wide catchment area between the metropolitan areas of Austin and Dallas. Regularly recognized as one of the top training hospitals in the country, we have over 40 residencies and fellowship housed here in Temple. This creates a strong education-centered culture with a premium on learning and professional growth.
Sometimes people ask how a medical center like Baylor Scott & White came to be in a city like Temple, Texas. Well, in 1897, Doctors Scott and White, who were surgeons for the Santa Fe Railroad, formed their own private clinic here in Temple. It flourished and grew, and in 1963 moved to this hillside you see behind me and has become a world-renowned medical center. In 2013, Scott and White merged with Baylor Healthcare of Dallas to become the largest not-for-profit healthcare provider in the state of Texas and one of its most highly rated facilities.
One of the things that we tried to incorporate in our postdoctoral fellowship in health psychology is to what I call creating a larger footprint in the medical community. In other words, what we're trying to accomplish is delivering to the medical community services that psychology has to offer. For example, the postdoctoral fellow has an opportunity to evaluate maybe a middle-aged man who is undergoing congestive heart failure, and possibly a candidate for the heart transplant or the left ventricular assist device. While at the same time in the afternoon, the postdoc fellow may evaluate an individual who is suffering from diabetes and is facing the prospect of some amputations that are in the near future. The challenge for the postdoc fellow is to help these individuals both on an inpatient and outpatient basis in terms of improving coping skills, functioning on a day-to-day basis to improve quality of life.
I originally came here to be part of the fellowship training program, and I was looking for opportunities, obviously, to work with a wide variety of patients who had different behavioral and medical presentation, and really get that health psychology training. We get to teach, we get to supervise, and that's been, I think, a great addition to my professional growth, at least, being able to get maybe those types of experiences I don't think I could have gotten every place else. And it's been really rewarding here, and I feel supported, and I can go forward with new ideas and feel like there's room to grow here.
Good morning, welcome to Santa Fe Clinic. I'm Dr. Amy Adcock. I'm the supervisor for the Integrated Primary Care Psychology tract here at Baylor Scott & White. You're also amongst the Santa Fe Clinic where the family medicine residency is also housed. The postdoc that is in our integrative track is intimately connected with all of our family medicine residents. You'll be expected to round with us on hospital service, be integrated with our research and quality improvement projects, as well as your day-to-day working with patients as a team amongst the family medicine physicians.
In the end-of-life track, the fellow focuses on 3 different areas primarily. First is working with the palliative and supportive care team in the hospital, seeing consults of patients who are terminally ill who are getting close to the end of life. The second area is working with the Scott and White hospice team, which involves interdisciplinary collaboration with the other members of the team, including physicians, nurses, social workers, and chaplains, and making home visits to the dying and their families. The third area is focusing on cases of complicated grief here in the clinic, of which unfortunately there are many. And by dovetailing the caseload to enable the person to see some of the more challenging cases, we're then able to explore which of the current empirically validated treatments for complicated grief would be most applicable for that particular case. This is one of the things that makes the fellowship so exciting. We're able to do customized treatment using the very latest methods possible in working with some of these very difficult cases. I think one of the greatest privileges I've had as a professional is working with individuals who are nearing the end of life, who are dying, and also their bereaved survivors. It's not a work that is done by a lot of psychologists, but for those of us that are called to it, it is immensely rewarding. And to be with a person at this moment of transition, and also after the fact when people are trying to adjust to loss, is an extraordinarily important part of the human experience. And we have a lot that we can offer individuals at this time. So getting into the details of that and helping a postdoctoral fellow prepare for that kind of work, to me, is one of the special missions of this fellowship and one of the reasons why we started in the first place.
So Temple, Texas, surprisingly, being a small Texas town, is actually a lot of fun. We have found like really fun food places, trivia nights with our psychiatry fellows and residents, and we've just had a blast just molding into the community and feeling really a part of such a small town vibe. And it's really nice because it is a kind of medical center town, so food options galore, and we're really in close proximity to all the major cities and towns around here.
We've got the lake nearby, is beautiful out there. You can go swimming. We've got walking trails and hiking trails in the area. And so if you are outdoorsy, that's in close proximity to you. If you like city life, urban type of activities, there's a lot of opportunity for that.
The mental health clinic is staffed by psychologists, psychiatrists, and counselors, providing behavioral health services for patients within our healthcare system. Our mental health clinic is the home base for the Psychology Fellowship as well as the Psychiatry Residency. Here, residents and fellows see a wide range of presenting problems of patients referred from within our medical system. We hope this video has provided you with a glimpse of what your training could look like here at Baylor Scott and White Health. For more information about our program, take a closer look at our website. We look forward to seeing your application come through the APIC portal, and we wish you the best in your careers wherever it may take you.